There's a lot of scanners on the market, and what do they scan? What are they actually capable of doing? Well, we want to know because we put them to the test and our clients put them to the test because we do a lot of full arch scanning, whether it's dentures or full arch prosthetics on implants, intraoral scanning with scanned bodies, scanning a lot of soft tissue. So we really have a high demand for our scanners. So we thought we would scan a bunch of prosthetics here at the laboratory that we asked doctors to scan in the office. So we're going to go through them one at a time. One of them is just a try-in of a denture, double arch denture like this, where the doctor would either do a wash or maybe not, and maybe did some occlusal adjustment, and we're going to scan that, upper lower. We're going to do one with a wash impression inside of it as well. We're going to scan something a little funky here. This is an implant-supported prosthesis that needs one more site picked up. And then we're going to scan something a little bit different here that maybe not everybody's thought of, where a patient, where you would take an alginate of a patient, pour it up in stone real quick and scan the stone. Why do that? Well, because some scanners just have a really tough time scanning a large volume of soft tissue. So scan the model. We'll prove we can do that. And then lastly, we're going to scan iJIGs, which is full arch implants on full arch prosthetics on implants, where we're scanning the implant position using analogs. So let's get started. Fortunately, we're going to put chapters in this. So if there are certain things you want to see, you just fast forward to that chapter and watch how we did it. In this scan, we're going to take 2 try-ins. You know, with our ROE Dental Lab system, we can send you prototypes that we know are going to fit. They're made from your master cast, but if they're not, then you can always do a wash in them. But our idea here is you can maybe do a little bit of equilibration on the occlusion, verify the fit, the aesthetics for the patient, and then really, if all you made was some occlusal adjustment, all you have to do is scan the occlusion and send it back to us. Scan the occlusion, scan the bite. We'll update our digital files and make you some final dentures. It's pretty slick. But let's just say you did a wash impression, wash, bite, registration, and everything. Let's scan that, because then you can digitally send it to us. All right, here we go. So let's talk our way through this scan. And what we always do with dentures is we always start with the intaglio. We always identify the full arch, as opposed to just, doing a pattern back and forth on the palate and the vestibule and the ridges. We want to identify the full range of the denture. So that's what we did there. You can see this thing just really scans nice and fast. Very impressive. Let's get inside here, like that, beyond the borders. All right, beyond the flange. And then what we're going to do is kind of like what we always do, which is we're going to start adding some of the facial in. Oh, let me catch up here. I'm going to add the facial while we're scanning the border, because that way it has some of the old and it has some of the new. All right, just like that. Don't get ahead of yourself. Don't start scanning the teeth until we've got this full range scanned here like that. And I think I could probably go a little faster. I don't want to, because I don't need to, and I don't want to have to make a mistake and start over, but kind of pacing myself here. Okay, there's that. And then we'll just kind of roll over to the occlusion. And then this is just normal scanning here. Let's bring it around. You can scan some of the lingual and, oops, getting a little shaky here. My fault. There we go. Come back around and get the teeth really nice. Get the linguals. Perfect, like that. And then, as you know from all of our other denture videos, we don't need to scan the palate. There's just no point in scanning it, because we need the intaglio to get the thickness. We've already got the border, and I am going to go across the border because I'm pretty sure this scanner can do it. Actually, I'm going to do it from the intaglio. And I just want to make sure I got this post-palatal border seal just like that. Okay, that's the lower. And then that's the upper. Got them backwards here, but that's okay. Save current scan, go to the next one. It's going to render here for a second. And then same thing, just follow the rule. The rule is scan the intaglio first. I'm going to go a little faster. It's a lower, not as much material here to capture. Okay, nice. Just follow the plan, which is to add some teeth, labial buccal area with the flange, and then come around this way. Okay. I'm going to change my fingers to a different position. There we go. It's really impressive how it'll actually pick up on a border where there's not a whole lot of anatomy, and start from there. Okay, all right, now I got to follow my rules here. I just started getting the distal extension, and we don't want to do that. We want to stay within our rules, which is capture the labial, just like so. Let's come back to the occlusal. Wow, this thing scans nicely. Okay, very good. Now we could, if we got the intaglio really good, we could just stop right there, because you don't really need the lingual. The thickness of a denture is going to be to a standard, but that's okay. We're going to scan it anyway just to prove that we can, even though that's the shiny part of the denture. There we go. See a little bit of my finger got caught in there. That's okay, it'll erase it. See that? Which actually does a really nice job of erasing scans that you don't want. I'm not quite sure why it's overdoing, going over that distal part there. Okay, there's your denture, 360, and now we're going to scan the bite. Save the scan. Okay, push play. And then this is where you want to decide if you're having any trouble at all capturing the bite on the patient, you might want to put both dentures back in the mouth and take the bite. Otherwise, if you can hand hold them, then just do that and scan a whole bunch of the teeth. You don't want to wait until it picks up the upper and the lower and then be done with it. Scan the full facial, because if something happens where we're not capturing the bite, or it's not putting the upper and lower together, we can manually put it together with a beautiful bite like this. All right, there's our bite. That's a fast scanner. There you have it. All right, this is another scan that's very, very common. And as you've seen from our other videos, we don't need to spray. We spray in the laboratory because we can get just a little bit better scan, even though our scans are perfect with our high-tech dental scanners. But we can get a little better when we spray it. So this one has some spray. But here's what we want to do. This is a patient where we send out a monochromatic try-in. Doctor equilibrated, and the doctor did a wash. And then instead of physically sending it back to us, maybe the doctor even printed this from our design. Printed it, tried it in the mouth, did a wash, equilibration, and then now that we know this denture is refined and ready to go. So let's scan it with the wash in it. Let's see if it picks up that color really well. All right, as always, scan the full scope of the denture first, come back and scan the rugae, the rest of the palate, and then capture the post-palatal seal. All right, well that was really fast. Maybe that powder does help. I mean, I know the powder helps. All right, so don't worry if there's some flash on the posterior palatal seal. That's fine, because we're just going to stop at the vibrating line. No issue there. And while this is scanning faster than a regular denture, a regular shiny pink denture, might even suggest to doctors to buy some spray. It's really inexpensive these days. All right, so scan, and then all we need to do is scan the teeth. because this is the wand is touch activated. So if you hit that shiny part up there, it'll pause it, which is what I did with my glove. Okay, we got it. That's the full denture. That's all we need. And then, so this is the case where the doctor did upper and lower wash. So you would just repeat on the lower, put the two together, preferably in the mouth, so you can really nail the bite, or you could hold them together. Either one, we'll take either one, and then upload, and we're making beautiful final dentures from these scans. This is a wonderful workup to make a final denture. All right, this one's just for fun. This is a denture that has already been fixed on 3 multi-unit abutments, and the doctor needs to pick up the 4th. Right? The implant was delayed, or whatever the reason is, or the angle was changed maybe of the multi-unit abutment, and now there's a void to pick up a temp cylinder. Now, in real life, this is going to have to be a very accurately made prosthesis, because we still got to screw it down on 3. There's probably a model in the laboratory, but the doctor really wants to have, let's say they want to have a shell to pick up that site. Let's see how this thing does when you're scanning a hole. All right, so this is the normal way to do it. You just, scan the full scope of the denture, picks up those implant parts nicely, and there's your void, which was our goal, to pick up the void. I'm going to come across the palate. I'll tell you, normally I don't come across the palate like that with these scanners. I keep going around the vestibule and then hope to pick it up with the vault. But this scanner does it every time. All right, let's get down in there and scan the inferior border. All right, got the implants nicely. Just kind of roll around this and make sure I get all that data. All right, and it's not a custom tray. We could stop if it's just a custom tray there, but we want to actually make a denture to try in. And this one's pretty shiny too. So follow the border around, just like we always do. Just like that. It's nice that that hole is not getting the system confused. Okay, come around the labial. Let's get the occlusion real quick. There we go. I have to say, it certainly does pick up wherever you put that head. It really does pick that up nicely too. If it gets a little confused and lost, you put it right back to an older spot where it captured it really well. Okay, let's see how we do here with the hole from the occlusal side. You can see on your camera this thing is really shiny. I don't think scanners used to pick up holes that well, or not pick up holes that well. That's impressive. Yeah, they always get a little lost on the shiny part of the palate, but again, we don't need it. We'll fill it in, and there's the void. No problem. So if this thing had 4 voids and you wanted to really just pick up 4 different spots, that would work. All right, another successful scan. This is edentulous, mostly edentulous arch. Sometimes these are tough to do in the mouth. So this can either be stone, or in this case it's resin, but resin, stone will be the same thing as far as scanning. And we're just going to scan all the land areas so that we can upload it and send it. And whenever we do any scanning, we almost always go towards the labial first, and then come around to the occlusal. You can see how fast this scanner is. It's fast, it's smooth. You can change that music if you want. Actually, I think you can put just about any soundtrack you want on there, which makes it kind of fun. So think about this situation. You've not been able to scan the soft tissue, or you don't even want to take time to do it. Or perhaps you've done more of a custom tray and you've displaced soft tissue, you've identified muscle attachments, and you want to go right to a bite block or a process base. Well, you've done it. You've displaced the tissue, you've poured it up in an alginate or in even a PVS impression, and you've scanned it, and now you have a perfect scan of the patient, and you didn't have to spend a lot of time scanning soft tissue. You got a perfect scan. So that's a model. Pretty simple. Most scanners will do that. That was nice and fast. All right, let's see how this scanner handles scanning for an iJIG. So an iJIG is basically a digital representation of the prosthesis with our special iJIG scan analogs. Now this one's a little different than normal. This is actually denture teeth set in wax. Lost a couple of teeth. Sometimes you lose teeth because of screw access, for whatever reason. But this fits in the mouth. It's verified. We know it screws down. The bite's good and everything. So what do? You put our iJIG scan analogs onto the prosthesis. We sell these, and then we just simply scan the prosthetic to give us the implant position, to give us tooth position, to give us the bite, and it also will give us an implant position based on those analogs. So we have the product is actually called iJIG Plus. So you would combine these scans with a very simple model that we have you make so that we can send you back an actual prosthetic to screw down. But you see in this process here, we are scanning multi-unit abutment analogs in our iJIG process, and with these simple scans, because you're going to scan the opposing and the bite, we can make you a final or prototype full arch prosthesis from these scans. All right, so this is doing a really nice job of scanning the metal. We'll go around to the lingual here in just a minute. So let's keep scanning the facial. We can also do this with some implant analogs, some multi-unit abutment analogs. So just contact us for which ones are compatible with our software. All right. I just set it on the table here, and that way it's nice and steady. Now I'm probably going slower than I should. This thing seems to go about as fast as I want to go. As fast as you want to go here. Oh, there's the table. Okay, so I'm going to hold it in my fingers. I don't want to scan the table. There we go. Okay, and then what you do is little trick here, you just kind of poke your scanner up on the lingual like this, then you come back down and you come to the next scan body and scan it, do a little rotating. You don't want to get two scan bodies in the same image unless you have to. There you go. That way the software doesn't get confused. It looks like it's got the exact same item in the scan twice. It'll sometimes it'll look like you're scanning something twice. And that is an iJIG scan. Wow, okay, that's really terrific. So now what you would do is you would take this prosthetic, screw it in the mouth, scan the opposing, scan the bite, and off it goes to the lab digitally. And then you make an analog model. But follow our techniques for that. From that, we will make you a try-in, and we'll make you a final. So that's the digital, physical, iJIG scan. That's a nice scanner. All right, let's see how this scanner does with an iJIG scan. This is a prosthetic a patient's been wearing. It's time for a new one. So what do? We just screwed in our multi-unit analogs, nice and tight, real firm. And then we just simply hold it on our fingers and we scan it. And we do this because we can scan the teeth, the tissue, the implant position, the opposing, the bite, all in one event, all in one chair side seating. One appointment. You don't have to have 5, 6, 7, 8 appointments to get this patient a new prosthetic. You just need your wand, our scan bodies, and just follow our technique. All right, so we have the prosthetic, and then what you'll see next is we're going to scan the iJIG scan analogs. So I'm going to hold it by one of the scan analogs, and then I'm going to come here on the other side of the arch. And what I'm going to do is I'm just going to poke up and grab one scan body like this, move a little bit down, pick up the next one, that, third one, since I'm here, I'm going to go ahead and scan the intaglio. You might be asking yourself, well, if you scan the intaglio, what about the tissue gap? Well, that's when you scan the mouth. So just follow our iJIG scan protocol for that part of it. But all we really want to do is digitize the prosthesis and have it aligned with the implants. That's what we're doing here. Try to get these scan bodies analogs as good as you can, because we use software that recognizes them and then registers them. Okay, so now we just have to get the one where my finger was. Let's hope this picks up. There we go. Wow, this thing really picks up nicely. Don't always experience that with all the scanners. There we go. It's going to remove where my glove was as I scan around that area, and we'll come up on the lingual too, and then the glove will totally disappear. Let me show you here. I'm going to try to do this without having to move my hand position. And you can even see this prosthetic has a big crack in it, you know, but the doctor verified that it fit. And oops, you can see it just fixed what it had. It had a little problem. It had a little concern with some stitching, and it reoriented itself and aligned itself. So you see here, there's a little break in the prosthetic right there. So it was time for a new one. I'm going to set it down so it's real stable, I think. Maybe not. Okay. I'm just going to do a little bit more of the occlusion to get these holes down in the holes there. Probably don't need to do it, but I'm going to do it anyway. All right, so that's about a 3-minute scan for an iJIG. So that was a really nice, successful scan of an existing prosthesis to make a new one. This is a heck of a nice scanner. We just scanned all these prosthetics, the two-side, the intaglio, double arch, wash impressions, things that are sprayed, not sprayed, things with holes, things with shiny objects on them. I mean, it didn't stop at all. We didn't have to restart one scan, not one time. So we scanned all these really just about perfectly. I really have no complaints or issues about it at all. Wonderful scanner. Good day of scanning.